Okay, so today there was some confusion regarding who is the speaker today. So we have our speaker as Dr. R. Shweta. Dr. Shweta, you are here? Dr. Shweta, please open your video. Yeah, welcome, ma'am. Yeah, yeah, you are not audible, ma'am. Can you please? Yeah, you are very much audible. So actually, Dr. Shweta will be having Dr. Shweta as a session speaker today. Welcome, Dr. Shweta. And her topic today is homeopathy and its surgical power based on philosophy. Dr. Shweta, I don't have your introduction details, so I'll ask you to please introduce yourself, please. I'm sorry about that. Please introduce yourself, ma'am, today. And yes.
Good evening, doctors. I'm Dr. Shweta from Tamil Nadu, and I'm working in Dr. Basil's Homeo Hospital for the past 2 months. And I'm not more experienced like you and all. I just completed my BHMS in the last year,
That's okay.
so I'm not that much experienced. So you
Yeah.
you people please forgive me.
No, that's okay. That's very perfectly fine. Everybody learns from the newcomers also and from the experiences also. It's all
Yeah.
the things. Yeah. So you will be speaking. You can give a small intro. You are working Dr. Basil's Homeopathy and completed your BHMS, and you
Ma'am,
will
I
be
can't
speaking.
get you, ma'am. I can't get you.
Hello.
Yes, ma'am.
Yeah. So you will be speaking today on homeopathy and its surgical power based on philosophy. So do you have
Yes,
a presentation? Yes.
yes, ma'am.
Please go ahead.
Okay, today we are going to see about that homeopathy and its surgical power based upon philosophy. First, we are entering into the preface to the first edition in 1828. In this preface, Hahnemann has to. Am I audible?
Yes. You are very much audible. Please go ahead. Yeah.
Okay. In the preface to the first edition, Hahnemann is criticizing about the old school for the method of removing the external manifestations mechanically. But he is saying that our physicians, we are just failing to treat the chronic disease by depending only upon the surgical interventions. We are not seeing the patient and seeing that the complaints as a chronic disease. We are just taking that as a external complaints, and we are just treating that by any mechanical methods or any surgical methods. So what Hahnemann is saying is, if we are removing that the external symptoms just by mechanical methods or any surgical methods, the internal disease which is remaining inside will be remain active in inside itself. The person will not get complete cure. Only the external symptoms will be removed, but the internal disease will remain as it is same, and it will remain active. Next, we are entering into the introductory part of the nature of chronic disease. In this one, Hahnemann explain detailedly about the three types of miasms. So in this, what he is saying is the external symptoms are nothing but these are the internal miasms which is trying to expel outside the symptoms. That is only the this external symptoms. So whenever we are removing that external symptoms mechanically, we are making that internal miasms to sit deeper inside, and we are making that internal miasms to grow aggressively. So he is saying that only the internal dynamic homeopathic treatment is the right method to cure both the symptoms and the internal miasms. So next we are seeing that H.A. Roberts' philosophy. In his philosophy, the chapter 19, the law of palliations, what is saying is our homeopathic physicians, many are having many confusions when they are coming to treat that incurable diseases. They are having lot of confusions than the other doctors. So whenever we are facing this kind of any surgical cases or any incurable patients, we are just trying to palliate the symptoms which is dominant in that patient, and from which symptoms the patient is suffering a lot. We are just trying to palliate those symptoms, just to develop a belief from the patients, and we are just trying to hide the seriousness of the disease and the seriousness of the complaint of the patient from the patient and from his family. So, at this condition, whenever we are facing this type of patients, that physicians are just trying to give a remedy which is similar to that dominant symptoms. At that time, these similar remedies just make the complaints to ameliorate for 3 to 4 days, or for more than few days. But again, the symptoms appear will appear with a more intensity. So he's giving an example of incurable cancer patients with the insomnia. So that insomnia may be the outstanding irritating symptom, but if you are taking only the symptom as insomnia without considering the symptoms, like some patients may have insomnia because of extreme coldness. So the patient will lie awake because of the extreme coldness. He will not get sleep and he will be awake over the night. But when he gets that extra bed clothing, he will be feel more comfortable, and then he will enter into the sleep. But the patient itself will don't know what is the cause of insomnia for that person. Some people may awake due to that there are any personal problems or any family problems, or maybe due to any business problems. That may be their uh, that may be their cause for the insomnia. And also we have to note whenever we are having this kind of symptoms, we must note also, in this case, if that patient is having feeling insomnia, we have to look after when the patient is feeling when the patient is not getting sleep, whether at the first of where he enter into the bed he is not getting sleep, or at the middle of the night, or with the sudden rush of any thoughts, or with the sudden rush of any fear, he is getting away from the sleep. Like this, we are in a simple way we have to say, that is a concomitant symptoms. We have to collect these also. But without collecting or without considering all these symptoms, we are just taking only that symptom as insomnia, and we are giving any similar remedy for that. It will the it's similar remedy for that. The patient will develop a sleep. Definitely, with that similar remedy, he will get sleep, and he will be. He can say that he is getting sleep and he is feeling better. But that sleep is not a natural sleep. It is an unnatural sleep, because we are giving that similar remedy to that only that insomnia alone. We have not considered the associated complaints, and the types of conditions we have not considered. Um, that may be only the unnatural cure. So in his philosophy, he states that these patients will yield to the law of stimulus with the pleasing results in their whole constitutional state, but not unless their symptom is considered with the concomitants that point to the remedy. Okay. So by this, he is coming to say that with these point, our homeopathy physicians are finding a alternative for a narcotics in surgical cases. By this, by remove because we are not only giving that similar remedy, we are by considering all these things, by considering all these concomitants, we are giving a well indicated remedy. So by these things, we are finding a substitute for the narcotics in these surgical cases. Then comes the Ken philosophy. In his philosophy, the fifth lecture, discrimination as to maintaining external causes and surgical cases. Ken states that this point, the discrimination between the maintaining external causes and surgical cases, is very essential for the homeopathic physician to understand the role when he wants to treat the patient with a remedy, when he wants to give any mechanical support, or when he want to advise the patient to the surgical methods. In this, he is given two things: maintaining external causes and surgical cases. In the maintaining external causes, whatever may be the case, we are just handling the case, and we may be giving the medicines to continually. We may be giving medicines to that patients. But if we are getting, if we are not getting uh, any changes or any improvement in that case, means we have to find whether any external causes there. That external causes may be any diet and regimens, or any environmental conditions, or some may be due to any poor hygiene. So even though we are trying to make that patient to thrive in that environmental conditions, or to that emotional stress, we have to remove that exciting cause to make our remedy act effectively. After removing that external cause only, we can get better betterment in that patient, or else at least we can make the medicine to act more effectively. In surgical cases, he's giving an example that if a man is get hurt, you don't call a carpenter to fix his wounds, and if the man's house is broken, you don't call a surgeon, you call a carpenter. So we must know when to give a remedy and when to give a surgical interventions. We must know that if a person is coming with a lacerated wound, and the physician is treating that person with a external person with any internal remedy or with any local applications, means he is saying that it is just in foolishness. Actually, he should sew up the wound, but he should not make that ulcer burn with a nitrate silver. So, if the physician is not able to discriminate, and he's treating whenever he's getting this kind of patients, treating the patient with applying plasters and local applications, or with the remedy, he will not be a good preserver for health. So, as a true physician, we should know when to stop. Then comes the lecture 7, footnote indispositions and the removal of their cause. In this one, we all know that indispositions are not the real disease. It is just a mimicking disease, that may be the temporary disease, which may be due to any external factors or maintaining factors. So in this case, already a person with the deep chronic issues, like psoriatic patients, already the patient may be having any chronic complaints, even though they can also develop this indisposition, like this mimicking disease, maybe due to any external factors, such as any diet and regimens, or due to any emotional stress. The psoriatic patients also, this kind of chronic disease patient also can develop this kind of symptoms. In this case, whenever we are removing this temporary problems, the patient can feel better, but the disease actually is sitting deeper inside. That deeper disease, or the chronic disease, will not get improved or will not get cured. Only the external disease will only the patient will get improvement or feel better from that external cause. So Hahnemann says, while removing this external cause, if the cause is very minor, we can leave that. That patient itself will cure from that minor symptoms, or else if we can give with a small dose of right homeopathy, will help that minor indisposition to come over. For example, if the patient is not feeling well with any strong smelling flowers or perfumes, he is getting any complaints, because of that he is feeling any faint sensation, we as a doctor, we should remove that complaints. And maybe some peoples, or some weak peoples, or sorry peoples, may cannot live in certain conditions. In that conditions, we should make the patient to move from that situations to some other situation. In this one, by moving this, that already the patient may be having some deep chronic causes, or any surgical cases, that will not get improved, or that will not get removed. The patient will not get cure from that conditions, but he will be feel better from these external conditions, and he will be somewhat feeling better. Our goal is not only to just remove the external factors from these conditions or from making the patient to move from those conditions. Our goal is to make the patient more comfortable, and we should remove that internal disease. So what Hanuman is saying is, we doctors can remove some physical irritants like something which stuck in the eye, or a tight bandage, or a pressure on a wounded limb, or some poison that is swallowed. We can remove that mechanically. Hanuman is saying like that. Some doctors, they have said, falsely claimed that these words as, Hanuman is supporting this external treatment because this external treatment is giving a true cure, like that they have given a statement, but Hanuman is believing that these are completely wrong one. By removing these external conditions, the patient can feel better, but the internal disease will remain as it is deeper inside with a more aggressive form. He's giving one story. Actually, one doctor said, I have cured a patient's pneumonia." Another one is saying, "Yes, you have cured the pneumonia, but the patient is going to die." In this case, he has cured only the case of pneumonia, but he has not cared about that internal disease, which is, or internal miasms, which is sitting deep inside. So in this condition, the real healing is not only just about the disappearing symptoms which is dominant. And he's coming with another example. Some people may have fistula in the anus. Fistula may be remained open after treating. The fistula openings may be remained open. So it is not enough. Some stronger peoples, if we are closing that fistula opening, some stronger peoples can live with that. But if the patient is having any conditions like tuberculosis or any other sorry conditions or any other chronic conditions which is lying deep inside that patient, and we are closing that fistula opening, means that can bring any dangerous complaints to that patient, because that fistula, now the fistula for that patient is not as a complaint, it is acting just as a mimicking for a purpose. That fistula is remained open there. When the patient is getting internally cured, the fistula will automatically get closed. So by this we are uh, if the we are what we are coming to say is, if the patient is healthy from the inside, that out external complaints will cure automatically. Then comes the Stuart clause. Here he is talking about the scope of homeopathy. In this one, actually, the in case of any surgical cases, for that he is giving an example. In case of any renal or hepatic colic, if the physician is firm and calm and he is very skillful, he can cure the patient with the remedy alone. But for this, he should make the patient, and he should make his family to believe, uh, and then only he can happily and he can freely move the patient to the cure. It is explained as, if a doctor is confident and calm and skilled, and the patient is also trusting him, and his family is also trusting the physician, a homeopathic physician can reduce, and he can prove that homeopathy remedies can bring this kind of wonders, and he can show some proof to that person, and to that and to his family members. If trust is missing there, the patient and the patient's family will not remain calm. They will be rushing or compelling the physician to give any palliative method of treatments. If we are if we are getting onto the compulsion of physicians or patients, or his family, we are giving any palliative methods, we itself misleading the case to some other track. So, in some cases, building trust will take time. If we are making the patients and the family to believe, we can freely move and we can give a result and we can make them believe, and they will also wait. They will also hand over everything in our hands. Some peoples will not believe. In that case, it is very difficult. But in that case, we have to some peoples will compel to make give a palliative method. In that case, a true homeopathic doctor must stay true to his principle. Uh, by doing this, we will get many judgment from the other doctors and criticisms from the other doctors. But uh, if you are following all these things, we can give cure in the surgical cases to the patients with only the homeopathic treatment. So, then the Richard Hooks in his lecture 4, the knowledge of disease, he is coming to say we have to know, we have to understand the disease process, um, how the disease is originating. Then after this, what is going to come, what uh, at what situation the patient is going to suffer, like that. We have to understand the process of disease. Mm, for in this one, if we are understanding the process of disease, we can easily, he's stating that we can give the patient's cure with the homeopathic treatment alone. He suggests that a thorough understanding of the disease can sometimes obviate the need for surgical interventions by allowing for effective homeopathic treatment. So even though, for instance, in some cases, we are in some cases with the complaints of bone decay in the spine or any pneumonia in elderly people, they have cured with the phosphorus. And we all know Cyanothes americanus acts well in spleen. But if we are giving those medicines similar to any particular organ or similar to any particular symptoms, if we are giving in this way, we could not get that complete cure. It will feel, make the patient to feel better, but it will not bring the patient to complete cure. So what explanation he's saying is, in the understanding of the disease also, by examining with any physical examination or with any lab investigations or with any stethoscope, uh, we could not come to the solution for selecting the remedy. He is stating that similar remedy alone is not enough. We have to move to the similimum. We are, we have to consider all the, as before we have discussed those indispositions and maintaining things, concomitants. We have discussed many things. By considering all these things, we are entering from similia to the similimum. When we are moving into that, we can give the best chance of healing. So then comes the Dunham's philosophy. Here he has given many surgical cases as example. For that, one person is suffering from convulsions, um, convulsions for a long period of time. After a serious investigations, they came to know in the sciatic nerve, a bullet was inside and it was pressing on the sciatic nerve. Because of this only, the patient got convulsion. So in this condition, they have referred the patient to the surgery. So after removing that bullet, he came to the normal one. Then comes the a baby having a convulsion for more than 2 times in a day. On a thorough investigations and thorough case taking, they came to, he asked, what are you giving to your baby? Then the mom said molasses cake. Then cake. Then he asked about what is the preparation manner of that cake, he asked. Then he advised to give just a wheat flour cakes. Then after that, after giving the correcting that diet and regimens, the baby came to the normal position, and the baby's convulsion was stopped. Then he had given another one example as a nasal polyp condition. Yeah, a lady was having a nasal polyp condition, and she has undergone many treatments, but she could not get relief from that. At last, she was suggested to take a surgery. But when she was prescribed with an calcarea carb, and with the after administration for few days, she has also given a lime water to enhance the make the remedy for to act more effectively. She was completely cured without surgery with the homeopathy remedy. So in these conditions, while handling surgical cases, we should remember these things, that we should consider the internal miasms. We should not see only the external complaints which is lying outside. We should treat the internal miasms which is lying deeper inside, and we should consider the law of palliation. In all the conditions, we should not enter into the law of palliation. This may mislead the tract, and whenever it is needed or wherever it is needed, we should know to stop, and we should advise the patients to take a surgical interventions, or we should avoid the maintaining external causes from the person. And we should not consider only the similar remedy. We should also enter into the simillimum, that is well indicated by individualization. We should consider the totality of the symptoms, and we should find the simillimum for that person. Okay. Then comes some of the remedies which are acting as an alternative for surgery in female cases, for making the uh, lady in pregnant ladies to make us a normal vaginal delivery. Our medicines like Colophyllum, Simsifuga, Arnica, Gelsemium, Pulsatilla, these medicines are helping in this one, especially Colophyllum and all will make the baby's position also will change, and it will make the uh, normal vaginal delivery. And in some cases of minor fractures, our symphytum officinal and the calcarea falls alone will do wonders in those conditions. It will make the callus formation, and it will support the bones to grow, and it will support in that minor fracture conditions. Like this, in many other conditions, in boric itself, it is given collinsonia and myristica, these and all acting as a substitute for the surgical methods. And we are having lots of medicines like in BPH conditions, Sabal cerulata, like that. In nasal polyp, calcarea carp. In calcarea carp, lemna minor, like that. And in tonsillitis, barretta carp, calcarea carp, sulfuris, hepasulf, like this. We are having many drugs that we all know, and we are just making use of those medicines in our practice in this kind of surgical conditions. Then Dunham is giving another one example of ovarian tumor cured by cholosynthesis. In this one, a lady aged 38 years, she was having um, the ovarian tumor. Dunham met that person in October 10, 1864. The tumor was grown in bigger in size, and it was between the uterus and vagina anteriorly and the rectum posteriorly, that is completely occluding the vagina, and the patient can't even walk, and is suffering more from the pain. Without any expectations, he gave colosins 200. Then after 1 month, in November 1, when he saw the patient, she said that that pain she's actually he prescribed that colocin for only pain. That patient also said she's having betterment in that pain. Then after 4 months, she said that she's completely free from that pain, and she is able to walk, and now she is able to make this household works. And then she was moving to Europe. So she was asking for the for more colosins, because in the fear of whether she might have that pain in future. And by thinking that, she got colosins and went. After 4 years, when she returned from the Europe, already in March 1st, she got relief from that pain, and she felt better. It's not. Uh, from that, she doesn't have any type of pain, and the size of the ovarian tumor also is shrinked a very lot. So actually, we all know that colosynthesis is known only for the action upon intestinal mucous membranes and on certain plexus of nerves. We So by this, he is coming to say we are having many medicines like this, but which is not proven, or which is not known to everyone. Only limited remedies we know. So this job is this goal is in our hands. Our as a homeopathic physician, we should find out and we should dig out these kind of results from our materia medica. We should find a lot of remedies like this. Many medicines are lying hidden, which is capable of curing any surgical conditions without surgery, which is giving any magical cure is lying hidden. So it is in our hands to find those medicines to out. So that the points to keep remember while taking any surgical cases, as already we discussed, we should keep remember the internal mechanisms. Whenever it's needed, we should remove that external factors, and whenever it is needed, we should stop. We should stop, and we should make the patient to move to the surgery. We should know to, and we should know to discriminate between the maintaining external causes and the surgical cases. We should not just palliate the symptoms. We should consider the totality of the symptoms. We should not based only upon the similar remedy. We should consider the minimum, and we should find out the well indicated remedy for that individualized person. Okay. So by keeping remember all these things, we can treat the surgical cases without surgical interventions with our homeopathy remedy itself. Thank you.
Okay, thank you, Dr. SWETHA. It's a wonderful presentation, no doubt about that. And I must congratulate not only you, but to your great salute to your teachers also, because you just completed BHMS in 2024, and within 1 year, you was capable of deliberating such a nice presentation. Unfortunately, some technical problems was there, but you really survived. And moreover, it's a great indication that we must thorough to claim as an honorable title of a genuine homeopathist, as mentioned by our master, all these basic things. But unfortunately, what happens is that everybody is trying to learn on some medicines in the name of the therapeutics. So,
Yes.
time for discussion. Those who would like to participate, please raise your hand. I think, could you please mention your name of your teachers who taught you organ of medicine in your institution?
Yeah, it was a wonderful session by Dr. Swetha today, and she told us about the surgical roles of the homeopathy. How can we treat the surgical cases with our medicines? It was a very nice session. It was our first session, but quite well done by Dr. Swetha. Yeah.
Thank you, ma'am.
Yeah.
Actually, as a seniors, we all know the conditions are, we all know the principles to follow in case of surgical cases, but we should keep remember these points. We should not, some peoples may really well dealing into the pathological symptoms or any pathological therapeutics, but we should keep remember all these things. By remembering all these things, we can give an entire cure from the internal miasm itself.
Yes, yes.
For-
Obviously, yeah. Obviously, surgery has its own side effects. Whenever there is a surgical removal or something, some other diseases pops up, and the body responds in a different way. So, homeopathy can definitely remove those effects and cure the things non-surgically. Yes. So, anybody else can also have their inputs or case sharing here today.
Hi. Very sorry for attending at delayed time. I was in a Mother's Day program, and I come to know I have engaged one person, and he gave me the report that it is performing very well. Once again, thank you, SWETHA. And as far as my case is concerned, our team, SWETHA doctor, have started this connection with IFPH. And once again, I am very proud of you, doctor, and I got the news that you have done well. Thank you once again.
Thank you, doctor. Thank you. Actually, I wish to thank Dr. Basil sir. Because of him, and after entering into the Basil family only, I got these many opportunities. and I have done my first article. Because of that only I got this opportunity also through Dr. Danish sir. So I'm very thankful to Dr. Danish also for giving me such opportunity.
Yes, Dr. Swetha, it's really a very good session indeed. Even though there was a problem with sharing the PPT, you have done justice your webinar, because you were well prepared on that. That's the reason why even without PPT you are able to make it a big way. And congratulations once again. Get ready for another session. And whenever there is such a problem, you can definitely forward your PPT to any one of us, so that we will try to upload it from our end. That's what. That's even our guest, our moderator. Dr. Neha Kakar was a very good person in doing that. He's a very good person in doing that. Unfortunately, she didn't have your number. That's why she couldn't do that. Okay.
Yeah, Dr. Dinesh, actually there was some confusion. I got, I was in the impression that Dr. Anjali was taking the session today. Yeah, but Dr. Shweta was there. So that's why there was some confusion due to that. Yeah. Yeah, but the session went well in the end. All is well that ends well.
Yes, so you know, it's a very good session indeed. And you really managed well also. Really,
No,
it's also great.
it's everybody's effort. Yeah.
Okay. Okay.
Yeah, well, it would have been good if Dr. Shweta also could have shared some practical cases also. Dr. Shweta, can you share one or two case here? Any case you remember? Surgical case which you have treated homeopathically.
Yeah, while studying, when we came across about that symphytamide, this is a simple case only. But when I came across about that symphytum officinal and the calcarea force, these drugs will help in the fractures, and it will promotes the formation of callus, and it will join the bones. Whenever I was reading that line, I have never believed that one. How it will happen like that and all, I have thought. But when I gave this remedy to that fractured patients, and they when they said now I can able to walk, now I'm not feeling that kind of pain, and I'm feeling something is happening in that side, like when I'm hearing those kind of words from the patients, I came to believe this kind of remedies. Before that and all, I have never, I just I didn't believe in this symphytum and the calcarea force in case of fracture.
Excuse me, let me add a few things. Why our students are not believing? Because they are not reading all these things. That's the main problem. The therapy, it's a homeopathic therapy is such an extensive subject, and unfortunately, our teachers are failing to bring the attention of the students to these topics. Hundreds of examples are there, and all these symptoms we got. We always claim I cured this medicine with this symptom with this medicine. From where you got this input? From the effort of masters. Then why should you not believe them? So it is that is why I
In the
want to
beginning
know
of my degree course, I was like that only. But after that, whenever
yes,
I was
yes.
when I learned everything, then only I believed him.
As rightly mentioned by Stuart Close, the man who sells should first believe. But here the seller is not believing. That's the problem. Dr. Abida, what is your opinion?
Yeah.
Yes, please.
So that only for me only
Please
I
wait,
have
please
taken
wait.
this point.
Yes, Dr. Abida. Yes.
Yeah, like you said, believing is the first thing we need to have. Whether we are doctors or we are patients, whether whichever comes, once the belief is at a state, then there will be always confusion whether it's going to work or not. So belief is for sure to be the topmost, and then rest will follow. Obviously, the action will be going on. The remedy will work as it is supposed to work also, provided patients are taking everything in the correct way, how it is prescribed.
Yes.
Thank you.
Extensive reading is from Abdul Salam, sir, who brought all these fellows to this platform. Sir, please. Yes, Abdul Salam, sir. Definitely, we should invite him. Yes, please.
No, I would like to say Dr. Swetha done very well.
Thank you, sir.
This is the first attempt in IFPH.
Yes, sir.
Yes, yeah. It's a nice program. You've done very well. Okay.
Thank you, sir.
Thank you for coming. And I would like to invite you another programs, not programs. Okay.
Thank you.
Welcome.
Thank you so much.
Okay. Thank you.
Yes, Dr. Neha, please continue. Dr.
As
Neha, please.
Dr. Manoj said, now I have learned to develop belief in the homeopathy. For that only, I included the chapter of Stuart Law's The Scope of Homeopathy. Here, he is mentioned about only that physicians believe. Whenever physician is standing firm and calm, and whenever he is developing a confidence, he can bring wonders in homeopathy.
I think Dr. Neha is on travel. Yes. Yes, Dr. Neha.
Yeah, yes, sir. Actually, yeah, I'm driving. That's why I can't open my video, but I can talk. Yeah. Yeah.
Yes,
So,
please continue.
yeah, so it was a very nice session. We are talking about these surgical cases. I remember one case when I was initially just started my practice. I had this patient of ovarian cyst and also fibroid in uterus. And initially, I was also very skeptic how to treat this because it was my initial years of practice. So I was very, you can say very fearful that whether I will be able to treat the case or not. But eventually, after 1 year or so, that case got cured even. And the patient she was showing to some allopathic doctor also. And he was astonished that how can cyst disappear from the ovary, or how can fibroid disappear from the uterus. So these are the things which we need to believe. We know that homeopathy can cure, and we are taught also. But eventually, when we see them in practice, then only we also as doctors can them. Yes. And that instills also in us the confidence to practice homeopathy, and further also take very, very more difficult cases and more incurable cases, which the allopathic fraternity say that they are incurable. But obviously, we can cure them easily with homeopathy. Not easily, but by hard work and, by studying the materia medica and applying the philosophy of organon, we can definitely cure the surgical cases. Yeah, so we had a wonderful session with Dr. SWETHA today. Yes, sir.
Ram Barwais, sir, raise your hands. Please invite him. Ram Barwais is waiting, sir.
Oh, thank you, Dr. Manojji and Dr. Neha Kakkar, and Dr. Abdul Salam and Dr. Avida Salam, Namaskar, and Dr. P. Saila. And congratulations, Dr. R. Sweta. Very good describe surgical base in homeopathic treatment.
Thank you, sir.
Some diseases is curative way of treatment. Homeopathic, piles, hemorrhoids, ovarian cyst, and etc. So very good describe the surgical based homeopathic and presentation. Excellent session. Thank you. Very, very thanks. Thank you.
Yes, thank you, Ram Barwais and all those presenters' participation. Dr. SWETHA, congratulations, and come to your platform regularly. Not only you, but bring their friends also, so they will be enlightened. Definitely not out of that. That remark will be conclude today's English edition. Hope you will be back again tomorrow. Till then, goodbye, and Dr. Shaila to continue the program in Malayalam. Thank you.
Thank you.